Good morning, everyone. It's 10 o'clock now, and I see we only have a few people joined. We will allow a few minutes, maybe let's see where we will be in 5 minutes time. Then we will then start. Thank you. Good morning once again. It's 5 minutes past 10. Our guest speaker is struggling to join, so we are helping him to come in. And hopefully, in the meantime, we could be getting in some more people. So as soon as he is in, we are going to start. Thank you. Good morning, once again, uh, and welcome to the second webinar of the NACCW. My name is Donald Ngonyama. I am a director at NACCW. We were supposed to be welcomed and introduced to the program by our national chairperson, Fiona Balgobind. Unfortunately, she has been called to an urgent meeting with the Department of Social Development. As a result, she is not able to join us. But if they finish before we finish our meeting, she is going to join. So I am going to step in to also lead the program. In my welcome, I want to start by reflecting on the first webinar that we held on the 26th of February on deinstitutionalization. And for those people who joined, you will remember that we had volunteers for the task team, and those volunteers we have recently communicated with them, and that we are going to be having our first meeting on the 9th of April. So just for you to note that that process, it's going forward. We are holding it with the care that it deserves and the commitment that it requires. And also as part of the opening, I also would like to welcome our guest speaker. But before our guest speaker comes up, I understand he is joined. I want members to just note a few things. Please make sure that you write your names on the chat box, indicating your presence, your attendance to this webinar. We have also applied for the CPD points. Unfortunately, by this time, we have not received a response. But should we receive a response, we are going to check if it's possible that you could be accredited for those CPD points, because they will be due to you. And then if you are attending in a watch party, also write down the names of the people who are attending with you. And it helps when we get people's contact details, your cell phone numbers, as well as your email addresses, because we are able to communicate with you. We also urging members to please join as a member of the NACCW. And membership fee, it's 50 Rand. That 50 Rand covers a whole lot of benefits that you will see on the website. And it's easier to join this time because you just go onto the NACCW website. It will direct you to joining or renewing your membership. So it's important that we've got members, because that helps us to represent you with the confidence that we have got people who are supporting the association. We were expecting to be joined by some international colleagues. I am not sure if they have joined, and if I don't see anyone yet, but if I do, I am going to acknowledge them. And for now, every one of you, please feel welcome, feel acknowledged. We are hoping that we are all going to gain from this webinar. I'm not going to say much, just in case I happen to now start talking about the content of the the topic of today, which I think it's important that you get it from the presenters themselves. The presenter today, who is our guest, is from Corruption Watch. I think many of you will know Corruption Watch. You know, with a lot of corruption happening in our country, if you read and follow the news, you probably will have come across them making comments, making statements about the corruption that is happening in our country. And we felt that it's important that as an association, as a child and youth care sector, we also turn our eye into corruption, because it is everywhere. You find it in the NGOs, in the NPOs, community-based organizations. You find it in the child and youth care centers, and you find it in different forms. We need to be talking about it, and we all know that this is against the child and youth care work ethics. It's against the ethics of our profession. So we have to say no to any form of corruption that it's being identified, or we suspect that it might get into destabilizing the good work that all child and youth care workers in our country are involved in. So Mzandile Mbanjadwa is he is employed by Corruption Watch, and he has accumulated a number of certificates. But what is critical about him is that he is currently studying law. And I think you will understand the seriousness of that studies that he has taken. because of the nature of work that he is doing and issues that he has to deal with, he has enrolled himself to study law. So I think that is all that I'm going to say about Mzwandile. And if there is anything that he would like us to share with us, he is welcome to share that. Mzwandile, I'm going to hand over to you now to uh, take us through your presentation on this topic. Thank you.
No, thank you very much, Chair, and thank you for having us. Good morning, and good morning to everyone who has joined. As the chair rightfully said, my name is Mzwandile Banjatwa. I'm a projects coordinator at Corruption Watch, and I'm one of the organization spokespeople. So I speak on behalf of the organization on variety of matters. Corruption Watch, for some who do not know who we are a non-governmental organization which operates in the civil society space. We were formed in 2012 with the sole mandate of fighting the rising tide of corruption in our country. And we do this by encouraging members of the public to report incidences of corruption to us. We then action those reports, either through selectively investigating some of those reports. We also mount various campaigns on these reports, and of course we undertake research to determine the trends and hotspots of corruption, to then interpret what the data says to us. We mount different campaigns based off of that. We release sectorial reports, which speaks to the challenges of corruption in various sectors, be it the private sector or the public sector. We have released reports that is focused on local government, on police corruption, on land, on the share equity scheme, on mining, and also we have released a report on the health sector as well as education. So all of those things that we have been able to do have actually assisted us in being able to also undertake advocacy, where we sort of lobby and put pressure on the state to change and amend certain weaknesses within the anti-corruption legislatures and various pieces of legislation that is there. And in the various investigations that we have done, and you might know about some of these, some of them have actually assisted us in being able to strategically litigate against various entities. We have litigated against SASSA on the matter between SASSA and Cash Pay Master Services, where we were able to successfully have the money that was irregularly transferred to Cash Pay Master Services, amounting to over 130 million rands, which we have been able to give to have brought back to SASSA. You would also remember the matter between the state and also the Seriti Commission, the Commission of Inquiry into the Acquisition of Arms, which is loosely referred to as the Arms Deal Commission. We were able to have those recommendations nullified. So those are some of the things that we do as an organization. I myself have been with Corruption Watch for over 10 years now. So I am a sort of what you can refer to as a specialist, I suppose, in anti-corruption matters. But today I was asked to come and speak on a very important topic, and we work with a variety of people. We form partnerships with varieties of entities. We serve in various forums, be it the anti-corruption forums in their multiplicity, whether it's the water sector one, whether it's the one that is focused on the healthcare, on built environment, immigration, and border management, as well as the water sector. So being asked to come and speak on integrity, and linking that with child and youth and youth care workers is a very important topic. So integrity in the work of child and youth care workers is not an abstract virtue. It is a daily practical commitment that shapes the lives of some of the most vulnerable members of society. At its core, integrity means consistency between values and actions, doing what is right, even when no one is watching, and especially when systems are weak, when there's under resourcing, when there's also scrutiny in the sector as well. In the child and youth care sectors, workers often operate at the front line of social injustice. They engage with children who have experienced neglect, who have experienced abuse, poverty, and systemic exclusion. In this context, integrity becomes a form of protection. When a child care worker is honest, when they are accountable, when they are ethical, they create a safe and trustworthy environment where children can begin to heal and rebuild their sense of dignity. But integrity goes beyond individual conduct. It is deeply tied to the broader project of social justice. And social justice demands that there be fairness, there be equity, and dismantling of structural inequalities. Now, as child and youth care workers, through your daily interaction, you guys are uniquely positioned to either reinforce or challenge these inequalities. When you act with integrity, you resist practices such as favoritism, such as neglect, such as exploitation, or the mismanagement or the misuse of resources. And instead, you promote fairness in access to care. You ensure that every child is treated with equal respect, and you also advocate for those who are often ignored. This is where integrity then intersect directly with the human rights agenda. The right of children to safety, the right of children to education, the right to health care, and the right to dignity are not on its own self-fulfilling. They depend on a system and critically on the people within those systems. So a childcare worker with integrity becomes a custodian of those rights. They do not merely provide services. You guys uphold the principle which is enshrined in the framework such as the United Nations Convention on the Rights of Children, ensuring that children are not treated as passive recipients of care, but as right-bearing individuals. And moreover, integrity fosters accountability, which is essential for both social justice and also human rights. Now, in an where corruption, where mismanagement or indifferences may exist, an ethical care worker can act as a critical line of defense. You can identify and report these abuses. You can challenge the unjust practices and contribute to building a culture of transparency. This does not only protect the children, but it strengthens the institutions that are meant to serve the public good. The positive impact is both immediate and also long term. So in the short term, children, of course, would experience a safer, more nourishing, more nurturing care. In the long term, they are more likely to develop to trusting the system, understanding their rights, and growing into individuals who value justice and accountability. So in this way, integrity in childcare in childcare workers contributes to breaking the cycle of marginalization and also injustice. But ultimately, integrity is not just about personal morality. It is a form of social action. Every ethical decision that is made by a childcare worker is a step towards a more just society where human rights are not theoretically ideals, but they are lived realities of every child. So, in keeping with with the theme of integrity, we have themed our conversation today, our presentation today, as integrity as a strategic lever of advancing social justice and human rights in child and youth care worker. So integrity as a strategic lever means using honesty and ethical behaviors as a tool to create real change, not just as a personal value. So maybe just to break this down, one, we all understand that integrity is doing the right thing, even when it is hard to do so, or even when no one is watching. Strategic levers, on the other hand, refers to something that is used on purpose to shift and improve a situation. So when we put this together, what it means is that you don't just have integrity, you use it deliberately to fix problems, to challenge injustice, and to improve systems. Um, so maybe as a start, you would understand that in a sector that you operate in, um, and this is unfortunately a very difficult, but it's a very honest statement that we have to make, that harm in the sector does not only happen because people are cruel. It often happens because systems are weak and good people learn to live with those weaknesses. So today is not about whether we are good practitioners. No, no. It's about something much harder. Are we actively interrupting injustice, or are we learning to work around it? I want maybe to ground our conversation in reality and base it on different cases that we may know about in some instances, because integrity is easy to talk about in theory, but it becomes uncomfortable when you look at the actual failures, especially ones that are quite familiar to us. So I will be focusing on various cases, and those cases will also highlight three things. They would show us how systems actually behave under pressure, how they expose, and they also expose how corruption and neglect becomes quite normalized. And most importantly, they would force us to ask a question like, what would I have done in that particular situation? So maybe if we focus on the first case, and this is something that you guys are familiar with. There's been an NGO funding crisis in the country, and particularly in Gauteng. And most of you would know this situation, where NGOs that are providing care for children were not paid on time by the provincial department. And this was not once. This was a recurring issue. And what had happened was that as a result of this, facilities ran out of food, staff was unpaid. Some of the services, unfortunately, simply came to a stop. Now, here's the uncomfortable part of it. This wasn't because of a lack of money. There were funds that were there. This was a failure of administration, a failure in planning, and a failure in accountability. So if one was to ask, when a child goes hungry because funding was delayed, is that just a system issue? It's probably not. Or is it a human violation that is happening in slow motion? And where does this leave the practitioners on the ground? Um, do you absorb the pressure and make a plan? Or do you escalate these issues? Or do you document them? Because integrity in that moment is not theoretical. It is practical, and it's also very much risky. And the second maybe case that we would like to focus on is the South African Social Services Agency grants irregularities. And if we were to zoom out a bit, when we talk about SASSA failures, the contract irregularities, payment issues, it can feel a bit far removed from child and youth care workers. But but in actual fact, it isn't. Many of the children that you guys work with depend on those grants for food. They depend on these grants for clothing. They depend on these grants for basic services. So when there is corruption or mismanagement at SASSA, its impact doesn't only stay in Pretoria or in the head offices. It shows up when a child arrives hungry, when a family is unable to cope, when there's increased vulnerability and neglect. So integrity here requires a shift in thinking. Your responsibility doesn't, unfortunately, end at your facility's gates. You are part of a wider ecosystem of care. And when the ecosystem fails, your ethical responsibility expands, they do not shrink. And the third case that we would also like to look at is the special investigating units and their findings that they make. Now, if you look at the investigations by the SIU, a pattern becomes clear. Funds are allocated for vulnerable groups, and then procurement processes are manipulated. Service providers are irregularly appointed. Money then disappears. And what is left, unfortunately, is that we're left with under-resourced programs, we're left with collapsed services, and ultimately children who do not receive what was promised to them. And maybe let's look at some of the key points. Corruption is not abstract. It is not about it's not just about numbers. It's about a child who does not get fed, who does not get protection, who does not get support. And in many cases, a child and a youth care worker are at the last line of defense before harm reaches the child. And the fourth case that we'd also like to look at is the life as a Dimeni tragedy that most of us are quite familiar with. In this case, unfortunately, it's not a child care specific case, but it should make all of us uncomfortable. I mean, over 140 people died after being moved to unprepared NGOs. And when you look closely, this wasn't one catastrophe decision. It was a series of smaller decisions where warnings were ignored, where standards were lowered, and where accountability was avoided. So in other words, this disaster didn't begin with a death, it began with compromise. And that is a lesson for us, because in child and youth care, the same risk factors also exist. They are in some instances outsourcing to NGOs. They are resource constrained, but also they are vulnerable population with limited voices who are at risk. So the real question is, what are we normalizing right now that would become tomorrow's crisis? What are we normalizing right now that could become tomorrow's crisis? And maybe the fifth case study, or rather the fifth case that would also like to look at, is the Auditor General of South Africa's finding. And when we focus on what is consistent in what the Office of the Auditor General consistently tells us, is that across sectors and year after year, there's money that is spent without proper processes. Their services are paid for, but they are not delivered. And most importantly, there are no consequences. Now, if we were to bring this to the sector, when a municipality, for example, fails, water services also fail, sanitation collapses, infrastructure deteriorates, and where are many of these childcare facilities located? They're allocated in exactly those in those exact communities. So again, governance failures becomes an environmental injustice. And integrity then would mean recognizing that you are not just working with children, you are working within a system that shapes their entire reality. And the sixth case that we would like to look at is the child protection system failures. And this sort of brings it quite closer to the work that you guys do. We've seen repeatedly where there are delays in removing children from unsafe environments, where there are poor monitoring of foster childcare placements, or where there are overwhelmed social workers. Now, of course, we all understand that there are workload pressures. But here's the uncomfortable question that maybe we might like to look at. At what point does overwork become an ethical risk? At what point does delay become neglect, or even become harm? Because integrity is not only about intention, it's about impact. Not only about intention, but it's about the impact that it bears. And what is also maybe very important is to start connecting these dots, as the proverbial term that is quite staunch in South Africa and has become part of our parlance. If we step back and look across all of these cases, and we look at the patterns that tend to emerge, we find that there is weak accountability, there's normalized non-compliance, there's silence within institutions, and very little consequence management. So we must stop thinking of integrity as an individual trait. Integrity is a system condition and a leadership responsibility. So maybe to make this even more real, imagine you are managing a facility, and you know that funding at head office, for example, has been misused. Your staff are quite stretched. The children are not receiving full services. But you also know that if you escalate this matter, funding could be cut. The facility could be shut down. So what do? Do you stay silent and keep the doors open? Or do you speak out and risk collapse? So Now, this is a level at which true integrity then operates, not in policy documents, but in trade-offs with real consequences. And another thing that we have to think about when we look at integrity is integrity as a disruption. From everything we've discussed, integrity is not passive. It is active, and it is disruptive in nature. And it looks like one, documenting what others ignore, reporting what others fear, escalating what is inconvenient. And this is where your role becomes bigger than care. You are not just practitioners. You are accountability actors within the system. And another thing that we maybe want to look at is the issue of human rights and making it real for us. We are often, of course, referred to the United Nations Convention on the Rights of Children. But to be honest, a right on paper means nothing if funds are stolen, if services collapse, if no one is held accountable. So we need to say this quite clearly, that corruption is not just a governance issue. It is a direct violation of children's rights. And we need to maybe start reflecting quite closely and look at maybe every major failures that we have discussed today. And every single one of them was visible before it became a crisis. All of them were quite visible before they became a crisis. It means that someone saw it, someone knew, and also someone hesitated. So the real question is not about those cases per se. It is about your current reality. What are you seeing right now? And what are you normalizing? And what would it cost a child if nothing changes? And maybe finally, we might also like to look at integrity as not just being about being a good professional. It is about deciding every day what kind of system we are willing to uphold. It's very important that we think about integrity in that way. Not just about being a good professional, it is about deciding every day what kind of system are we willing to uphold. So with that, Chair, I would like to leave it there. And thank you very much.
Thank you very much, Mzwandile. And I think people, the attendees will agree with me that it's very important that we hear this from people in your position who are having to deal with issues of research and understanding the depth and breadth of corruption in our country. And also getting it from somebody who is not within the child and youth care sector to say, this is what happens when corruption is allowed to take place. In a few of what you have indicated, you stayed along on the issues of integrity, that integrity, these are daily lived realities that as child and youth care workers, we must make sure that we live by on a daily basis. We hold them very dear in our hearts. You spoke about that it's difficult to live with integrity in a corrupt environment. And we know that we have committed ourselves to providing care to children, to doing our work within the ethics of the child and youth care profession. So we need to make sure that where we identify issues of corruption, we speak up. You spoke about that documenting experiences linked to corruption is very important. It's important that when we identify or we suspect that there is corruption taking place, we mustn't believe that we'll remember and just have it in our mind, but write it down, document it so that you've got a reference to make, you've got the date and time and how it happened. So that should you have to give evidence at one point, you are able to provide that evidence that holds. You spoke about the systematic failures and the compromises that leads to particular forms of corruption. And you spoke a lot about accountability and saying, I think this something that needs to stay with us, that we are accountability actors within the system. That is very important. So with all of that, I would like to say thank you very much for taking your time to be with us, to speak to the child and youth care profession. I am urging people to please write your comments. I see Zeni is saying something, is writing something on the chat box. And if you allow me, I would like to just go through a presentation before we take questions. In the meantime, just write down your question. And then after my presentation, we are going to be taking questions. Please allow me a moment to put up my presentation. Randy, could you please assist me? I am not able to put up my presentation.
Donald, do you want me to present?
Yes, please, from your side. Yes.
Okay, just give me a second.
In the meantime, if you could please be writing down your questions on the chat box. We will provide you with the time to voice them if you want to speak to the question yourself. Thank you. Okay, so following Mzwandile's presentation, just want to speak on the position of the NACCW with regard to anti-corruption and the anti-corruption policy. We understand that it's very important for organizations to each and every organization, child and youth care center, community-based organization, whether you are working wherever you are, to know that you've got an anti-corruption policy in your institution. Because we are saying that will ensure that it will build trust, it ensures accountability as well as integrity. Next slide. It's not moving on my side, Randy, if you're moving it. Okay, why anti-corruption matters? So we are saying that if you've got anti-corruption policy in your organization, it protects children and families that we serve, ensures that resources reach the right people, builds trust with communities and partners. It protects you and the organization. And corruption is not just financial, it harms people. And we heard that from Mzwandile when he was speaking about the systems, giving examples of decision makers, how it trickles down to affecting the vulnerable child. So that is what it does. And our presence there ensures that we are able to bridge that, to stop that from getting to the further disruption of a vulnerable child. Next slide. So there are core anti-corruption principles that we need to consider. Its purpose, the clarity, the causes, prevention, accountability, culture, leadership, and the goal. And we're saying that with regard to the purpose, we need to, as a sector, we need to promote transparency, accountability, and ethical practice. In terms of clarity, we are saying that there must be shared understanding of corruption, bribery, and fraud, and any other definition of corruption. So the organization, the staff, right from the governance to the lowest person in the hierarchy of the organization, they need to understand what is corruption and what to do should they suspect that it is happening. Some of the causes of corruption, we are saying that we need to make sure that we address the root causes that enable misconduct. And I'm going to talk further about that. We need to have very strong systems, and it's important that we audit our systems. And organizations, I think we all know that you need to be registered with the nonprofit organization, the NPO Directorate of the Department of Social Development. You have to submit your reports and audited financial statements on a yearly basis. We also need to ensure that there is training. And when we talk of audits, we're not only talking of statutory audits. We are saying within the organization, do conduct internal audits to understand whether you've got strong systems that can be a buffer to any corruption or any corruption that may find its way. There must be consistent consequences for misconduct. So if you identify acts of corruption, then you need to take action. And the ethical behavior must be practiced at all times. So you need to instill it. It needs to become part of the culture. And you need to lead by example. If you are in management in the organization, you are a supervisor, as well as being a child and youth care worker who is working with children, because the children are looking up to you as a leader in their space. A zero tolerance environment for corruption must be created in every organization that is working with children. That is very important. Next slide. Okay, then what is corruption? And what do we mean by corruption? When we talk of corruption, we are saying corruption, it's about the abuse of power for personal gain. In most cases, corruption happens because there is somebody who wants to benefit. It can involve bribery, could involve fraud, embezzlement of funds, and as well as misuse of funds. Next slide. The movement of the slides is a bit slow, so please pardon me when I go quiet after completing a slide. Key definitions in anti-corruption policy. I spoke about bribery, embezzlement, fraud, and what does that mean? So when we talk of bribery, we mean that it's giving or receiving value to influence decisions. And sometimes it might be found in the boards of organizations or in management of organizations where there are projects that or work that has to be done by somebody. And then for that person or a plumber or a builder, somebody has to come in and then somebody recommend this person knowing that they are going to gain when the person is appointed. Embezzlements relates to theft of entrusted resources. So as an organization, as board, as management of an organization, you are entrusted with the responsibility to look after the funds, and then theft gets involved there. So money goes missing. Fraud, it's about deception for personal gain. And then conflict of interest. It's very important that we look at this very, very closely, because this happens quite often. And sometimes you might find that there is a conflict of interest, but if you have not applied your mind, it's not so easy to identify it. This refers to personal interest that affects decisions. And then the whistleblower reports wrongdoing in good faith. So every time you identify or you suspect that there is corruption, you need to report it. And the whistleblowers need to be protected. An organization needs to have a system that encourages and allows people to report. And they need to be protected. And it doesn't, if you report, you may report anonymously, where you report and no one should know that you have reported. And the system within the organization should allow that people do reports without mentioning their names. And it becomes the responsibility of the management or whoever is charged with the responsibility to deal with any issues of corruption, to follow through what has been reported and address it. Next slide. So causes of corruption, what drives corruption? And Nzwangile also referred to some of this: weak oversight and accountability. So corrupt people are able to spot if the system is weak, if management are not watching, and then they use the gaps that are available in the system to practice corruption. Economic pressure and inequality. If there are economic pressures and there is inequality, then that could encourage corruption. Unclear rules and poor enforcement. So it's important that you've got policies that are clear, policies that where people are trained in the organization, they need to know what to do should they identify or suspect any acts of corruption. Lack of transparency and controls. This is very important because this has got to do with the money in the organization. You know, who are the people who knows about how much is coming in? How is it going out? How are your controls? Do you have different people with different responsibilities who are charged with the responsibility of releasing the money, or is it done by one person? There is so much danger in having one person having to do everything and end up releasing the money. So you need to have segregated duties of the different people within the organization, so that it is the financial matters are not held by one person or two people, but it needs to be there must be segregated duties, and to avoid any corrupt practices. Low risk of being caught. So if people know that they can steal the money and no one is going to know or notice, then they will go ahead and do it. That is why it's important that you've got strong systems. Limited training and awareness. So do ensure that there is training in the organization and that there is awareness. Everybody, every staff member in the organization should be made aware of the anti-corruption policies, and that as an organization, you have got a zero tolerance when it comes to corruption. Corruption often grows where accountability is weak. So if, like I am saying it again, if people know they are not going to be caught, they will steal. Next slide. Application of anti-corruption policy. So within the NACCW, we do have an anti-corruption policy, and we are saying we are willing to share if you need any support. We are willing to provide that support so that we assist you as well to be in a position where you feel confident you have done everything possible to mitigate against any corrupt practices. So the position of the NACCW, we are saying we are rooted in integrity, accountability, and child rights. And there is zero tolerance for corruption. And we are encouraging that any organization that is in the child and youth care sector that is linked to the work that we are doing, you need to have a zero tolerance to corruption. Our commitment, it's never accept corruption, always act and report concerns, act even when it is difficult. Mzwandile gave an example. If you know if you report corruption, an organization is going to be shut down, what do you do? So we are also saying, even when you know it is difficult, report corruption. It is the right thing to do. Next slide. Application of policy, where the policy applies, all areas of work. In an organization, you need to understand that corruption will happen everywhere in the entire system of the organization. It could be in program delivery, in procurement and finance, in recruitment. We know now that people sell jobs. So you might have a person, could be a member of the management team, it could be a member of the board who is involved in recruitment, and then people have to pay money for their CVs to be accepted or to gain employment. We need to guard against that in the child and youth care sector. Community engagement. You know, when we know services are provided for free, you don't want to have somebody who is now charging people to pay for those services. Monitoring and reporting in the MNE, it's that you can't rule it out. So we need to make sure that the entire system within the organization, it is tied against any corruption practices that may want to lift its head. Roles and responsibilities. So if the managers needs to communicate and enforce the policy. So if you are a manager and you identify corruption, you need to speak up, you need to take action. Ensure teams understand the procedures. That's very important. That's why we are encouraging that you need to have a policy, and that policy needs to be trained within the the staff, and that there must be a whistleblower option within the organization so that people are able to report and know that they are protected. Employees need to stay alert to risks, report concerns immediately. So even if it is your supervisor or the manager in the organization whom you suspect may be involved in corruption, you must know what to do if you come across that. Partners and planning, comply with policy requirements, report suspected corruption, assess risks in planning. Next slide. So prevention and controls, preventing corruption. We are saying that to prevent corruption, plan, identify, and mitigate risks early. So we mustn't wait for corruption to happen. We must try and be proactive. I spoke about segregation of duties, that you need to have different people who are responsible for the entire process of payment so that you don't have the same person who prepares and also has to sign and release monies. It needs to be different people. There must be registers. So whatever you are doing, dealing with people, you need to make sure that there are registers, declarations where it is required, have ongoing anti-corruption capacity building, monitor, do reviews, spot checks and documentation. And then if you are giving people money to perform some duties, withdraw funding if misuse is confirmed. If you identify that people who are getting money or given money to do some activities may be corrupt, withdraw it and act on it. Next slide. So what can you do? We're saying stay alert to risks, act ethically at all times, follow procedures, report concerns immediately. Doing nothing is also a risk. Next slide. Reporting channels, whistleblowing and investigation. How to report? So report to your supervisor or manager, senior leadership or HR, or as well as an anonymous email or hotline. So if you don't have that, it means you need to initiate that within the organization so that you can have people who are alerting you, especially if you are in management. Things can happen without you knowing, but the people under you may know. So they need to know what to do with the information. Report issues such as fraud or bribery, misuse of funds, favoritism, and exploitation. The whistleblower protection, make sure that there is no retaliation for reporting in good faith. Protection applies to staff, volunteers, and partners. And should any retaliation happens, it needs to immediately lead to disciplinary action. So if you know somebody who reported an alleged corruption is being threatened or asked questions, then you need to act on it immediately. What happens after reporting? There must be initial assessment. Don't take time. Immediately it is reported, start with the process. There must be an initial assessment and then investigation, ensure that check records, you must have interviews, do site visits if it's maybe in other projects within your organization or in other communities. Make sure that you visit. You need to be seen to be acting on it. Possible outcomes. The possible outcomes could be disciplinary action. Once you have done your investigations, it could be termination, where a person has to lose their job, recovery of funds. You may have to make them to pay back the money that has been stolen. Legal action, you may have to report that to the police, and system improvements as well. And I say, in terms of the system improvements, we need to make sure that we check our systems all the time. Next slide. Why this matters for child and youth care workers? It matters because child and youth care workers, we protect the vulnerable children. Corruption in social services often is in misuse of resources. We know, and I'm sure that some of you will know, you probably will have heard or you know of, food going missing from an organization, from a community-based organization, clothing that is donated, going to the wrong people, or funds or any donations in kinds coming in that is intended for children going missing, not going to the children. So we need to make sure that that doesn't happen. Ensuring resource delivery. A child and youth care worker who understands anti-corruption is better equipped to ensure that 100% of the resources meant for the children actually reach the children. We need to ensure that we prevent sexual corruption, prevents abuse of power, including sexual corruption in organizations and child and youth care centers. Next slide. Professional integrity, we're saying that it aligns with this with the South African Council for Social Services Professions Code of Ethics, and it's about legal compliance, knowledge of the Prevention and Combating of Corrupt Activities Act protects workers from being unintentionally implicated in gratification or bribery schemes. We need to help child and youth care workers identify red flags in procurement or service delivery before they become legal liabilities. Next slide. So building trust and life space credibility. The child and youth care takes place in the life space of children, the everyday environment of the child. So as child and youth care workers, we are role models. And by demonstrating an unwavering ethical stance, we teach children the values of honesty and accountability. Children will know and they will see us if we are not looking after them and not looking after what should be meant for them. It could be food, it could be clothing, it could be whatever it's meant for them. And if they see us misusing or taking advantage of it, they lose respect. We lose our status of being role models to them and the community. If we act on corruption, we ensure that there is community trust. When a community knows that a child and youth care worker is incorruptible, they are more likely to refer children in need and cooperate with the organization's programs. But if they suspect that you are corrupt, they ask themselves before they can allow their children to participate in the programs. Next slide. So anti-corruption training, NACCW, in partnership with the Adoption Centrum, we are encouraging child and youth care workers to take a free anti-corruption course. It's free of charge, you don't pay anything. At the end of the training, you get a certificate, and that certificate can form part of your profile, which strengthens your profile when you have to apply for jobs elsewhere. And if you are interested, you can scan the code that is there. using your phone, or you can visit the website. We will make the website available on the NACCW website as well. And the course takes between one and 2 hours. And at the end of the course, if you have completed it, you will receive a certificate. The certificate, when you complete the course, it will show you that you have completed the course, and now you can download your certificate. You can print your certificate and add it to the number of certificates that you have, add it to your profile, so that it also puts you in a much better position if you needed to apply for a job elsewhere. Next slide. So we are saying that together we build a culture of integrity in the child and youth care sector. And I think my presentation ends here. And if you have any questions, I'm not sure, Zeni, if there are questions already on the chat box, and people can ask questions. We do have time to take questions. Thank you very much.
Got a hand up, Donald Teresa from Limpopo.
Thank you very much, Teresa. Please come through. Thank you so much. Teresa, please, you may ask your question.
Unmute. Donald, there are some comments. This is an excellent presentation, so close to the real issues we face. That was about the opening input. Mandy Goebel says, are there questions? No. How do we proceed when those that hold ultimate power refuse to commit or follow through on addressing the matter? So that's a question from someone. Margaret says that you have mentioned 2 critical points in aligning with NACCW practice. Accountability is one of the child and youth care principles, and integrity is a value in the organization. It is important for child care and youth care workers to report and record corruption. Those were some points. I'm not too sure if we want to take them. There are others.
Yes, thank you very much. I'm going to start by asking if Mzwandile, if you want to respond to any or make a comment to the points that were made before I come in.
And just
yes,
before you speak, maybe there's one more question to you is there a possibility of partnering or seeking advice and guidance from Corruption Watch to advocate more powerfully on the systemic issues that were presented? We need to take next steps of action, as we are indeed failing our children and not protecting their rights due to fatigue and powerlessness in dealing with the powerful actors and systemic abuses in the sector. So that's just another point. Thank you.
Yes, thank you very much. Randy, if you could please put up the QR code again. It's being requested. Mzwandile, if you could, I think the last question, it's very much directed to you.
No, thank you very much, Chair. On the first one, on the first question about leaders or heads or those in charge who are failing to act either on corruption that they know that has been reported to them. If you would look at a piece of legislation like the Prevention and Combating of Corrupt Activities Act, it's quite clear on the legal obligation of accounting officers and senior officials. And it does not tolerate people who are in those positions who turn a blind eye against corruption. So in essence, what PRECA says is that any person in a position of authority, which includes accounting officers, municipal managers, heads of departments, CEOs of public entities, must report corruption. This must be reported if there is any suspicion of theft, of fraud, of extortion, of forgery, and of corruption. But secondly, it criminalizes this offense of turning a blind eye on corruption. If a person knows about corruption or they have reasonable suspicions of corruption and they fail to report it, that failure on its own become a criminal offense under PRECA. Particularly, it is quite clear on Section 34 of PRECA. And what is very much critical is that you don't have to be involved in corruption to be guilty. You can be guilty for not reporting corruption, particularly if you are tasked with the responsibility of being an accounting officer, and this bears a criminal penalty, which can be either imprisonment of up to 10 years, or a fine, or even both. But coming on the second question of partnering with Corruption Watch, of course, yes, this is what we do, and this is what specifically I do at Corruption Watch, being a person that is working under the stakeholder department of Corruption Watch. We do partnerships with various entities. Remember, anti-corruption work cannot be done in isolation. It's very much important for us to form partnership and strengthen, so that we can be able to strengthen the work of anti-corruption and put pressure on those who are in power to act more decisively. So our voice becomes much more stronger if we work together. So any possibilities and any opportunities of partnership is very much welcome. We just need to understand exactly what we want to partner with. Is it only just referring reports to us as Corruption Watch, or is it on a far more deeper issue, either being seeing if we need to push for a legislative amendment, if there are any opportunities for that, if we need to push for policy change, if there are opportunities for that, but we do encourage partnerships.
Thank you very much. And maybe Mzwandile, if you could indicate, should any organization wants to approach you outside this platform, how do they get to you?
Thank you very much, Chair. So I will share my email address on the chat, so that people can be able to then send me a direct email, and we can take it from there.
Thank you very much. Yeah, I think you actually addressed the 2 point. Yeah, and in the case where any matters of corruption are reported to NACCW, we also escalate them. Please note, we have had a few organizations that came forward to report to NACCW on issues of corruption. We direct those questions to the right platforms, and we follow up with them. So while we may not address corruption issues directly, if you bring it to our attention, we do link you up with the relevant bodies, and where we can provide guidance as to how you can make sure that whoever is alleged to be corrupt are taken to book. So do feel free to contact NACCW as well if there are those cases. Of course, with that in mind, that we are not the ones who are going to deliver to your expectations, but we will help you to get assistance from others. I saw Teresa is back. She is struggling with the connectivity. Teresa, do you want to try now?
Hello, can you hear me now, Mr. Ngonyama?
Yes, yes, very clear. Thank you so much.
Can you hear me now?
Yes, we can. You are loud
Okay.
and clear.
Okay. So firstly, I wanted to say thank you so much for the information that we have received through this webinar. Then mine, it was not a question, it was a comment with regard to this kind of webinar that we are receiving from NACCW. You guys, can you keep it forward? It's very successful and informative to us. So I wanted to ask for the anti-corruption training, uh, but that thing, but it's already submitted to the chat. That's one thing for sure. I wanted to ask for it so that we can scan and join for the training. Thank you so much.
Okay, thank you. Thank you very much for that question. Yes, please do try the scan. And if you are not able to if the scan is not working for you, communicate with us. We will send you the link. Randy, if you can also put the link on the chat, and then people can just cut and paste. That would also assist. And NACCW will be running 9 workshops in all the provinces. The dates will be provided to the National Executive Committee, so your provincial chairperson will get a date in the next week or two. And unfortunately, we can only hold a limited number of people in those workshops, but they will be on anti-corruption policies. Here, what we are going to be doing is we will take you through the presentation, and we will have more time to discuss and discuss and advise one another on whatever you are dealing with related to allegations of corruption, how you report, how you identify corruption on a local level. So we will be having more time, unlike here where we are just giving you a highlight. And then we will also share a draft policy on anti-corruption, and we'll take you through the anti-corruption policy, how it looks like, and that you can then from there, if you don't have one for your organization, you can develop one for your organization or strengthen the one that you have. And we believe that that is going to assist you under the current environment where corruption has now become a disease in our society. Zene, I think I saw your hand up.
Yes, thank you, Donald. I think that I just wanted to say sort of thank you to both of the presenters because I think it's been an excellent session. And I notice compared to other webinars, there is not as active and vibrant participation, but I think people are pondering the issue because I think it's a serious topic, and people might not be as confident to raise all the issues that are going on, in their minds at the moment. Because I think that on one hand, my understanding is that you, Donald, have presented the NACCW policy on anti-corruption that obviously people can take, adapt, understand, and use. And in many ways, it addresses and helps one look at how can we improve our systems in our organization, but also challenges each one of us to go back into the life spaces where we are working to see how could we improve. Immediately we go back the way we interact around this issue. If there are things that we were personally doing that we could change, we need to change that. If there are things that others on our team are doing that we need to give attention to, we might need to raise it. And of course, we need to raise some issues that came from this webinar with our leadership. But I think that looking at the subtleties that were presented at the beginning in the first presentation, the nuances of children's rights being violated because we don't raise our voices. And sometimes I think in the sector, people are fatigued. People are tired. People are scared that funding will be cut. I put in the chat box that there is this dry season that comes at this time in the year, at the end of the financial year, where grants are delayed because of poor planning. And be it childcare centers, be it project funding is not going to come on time. And people are anxious about how to deal with this issue that happens year after year. So it's expected that people stay without funding for a month, but the money will come. That kind of issue has been going on so long in the sector that it's become chronic. And I think that even though there has been advocacy at all levels, including the NACCW, I know it hasn't really resulted in the changes we would like to see. And I suppose that's why it does feel like at another level, a stronger advocacy on these particular issues now in partnership with a strong organization like Corruption Watch is important. But I'm just raising both issues, and I'm just hoping that others would like to make any last comment as well. But thank you, Donald. You muted, Donald.
Yeah, thank you very much, Zeni. I was calling for any further comments, especially with regard to the point that you've just made now. Okay, it looks like there is no other comments. And we will now move to the closing of today's webinar. And we would like you to take note that we have got these webinars on a monthly basis. And another webinar is going to take place around the same time in April, around the same week, the fourth week of the month. And we are encouraging everyone to make the time. It's only an hour, 2 hours. As a profession, we need to be learning all the time. We need to be communicating all the time. NACCW is making this platform available for us to learn and speak to one another. And we must utilize this opportunity. And as I indicated, this webinar today, we applied for CPD points. We have not received a response yet. And if we receive a response and we are allowed to allocate, we are going to be allocating the CPD points to the attendees. We also want the sector to note that Council is working on the finalization of the policy, which is sitting with the minister on CPD points. As soon as the minister signs the policy, CPD points are going to be mandatory. So child and youth care workers and social workers will be expected to complete a particular number of CPD points every year. And in that, we are encouraging the sector to use opportunities like this, where you attend workshops and webinars and any kind of other training, so that you collect those CPD points and that you are not left behind and meet the council requirements. And we would like to thank you for taking your time to be with us today. And we believe that every time we meet with you, we engage on various topics, we all learn and grow together. And to Mzwandile, we would like to thank you so much, to you and the Corruption Watch organization, for being available to interact with us and to make the time to come and present to our sector. And also knowing that we now have a partner in Corruption Watch, whom, if we identify suspicious acts of corruption, we can reach out to you for your guidance. We are very grateful to that. And corruption has become a disease in our country, and it looks like it's infectious. So each one of us it's expected to do something. We must all act in small and big ways. So if you identify or suspect corruption, don't keep quiet. We are saying, let's join hands and let's talk about it and let's report if we have to report. In these ways, thank you so much. And we wish all of you a very good afternoon. Then I'm not sure if there is anything you want to say.
No, Donald.
Thank you. Thanks. So the webinar is closed. Thanks.